go ahead and get started. It's 2 after, so I'll give everyone a couple minutes to log in. So welcome again. My name is Angie Sullivan. I am the program manager for the certificate Precision Health Graduate Certificate Program. And I just want to go over a few housekeeping items before we get started. Everyone is on mute, but I will unmute at the end for questions. And I'm going to go over a very short presentation. A lot of this information is on our website as well. You may have seen that. And you can enter any questions into the chat box as we go along. And the session is recorded, and I'll send that out shortly after this session. So a few years ago, a work group was charged to develop this certificate program. The certificate program is meant to complement a student's current degree program with the overall goal of providing training around improving population and patient health. The certificate allows students without a background in precision health to get an introductory knowledge set around precision health and around the different competencies that precision health contains. And it's administered by our department, Learning Health Sciences, and we welcomed our first cohort in the fall of 2019. So the certificate is open to all current graduate students, not only those in Rackham degree programs, but those in professional programs, such as those in the law school, those in the dental school, those matriculating further degrees like an MPH, an MSW, a PharmD, or an MBA. And although we get interest from faculty and staff about obtaining their certificate, we're not at a point right now where we can broaden our recruitment criteria to include faculty and staff in the cohort of students. However, that is a long-term goal of ours. So this is the first program at U of M to focus on competencies of precision health, and the first of its kind among US institutions to offer more breadth and depth of focus than programs in the more narrowly focused field of precision medicine. The certificate is structured around 6 different domains of precision health. And how the domains come into play for students is for them to try to take as many domains as they can, so they walk away with a broad knowledge of precision health. And you can see from the different domains listed here. And what's required is for students to complete 2 of the 6 domains. And we have over 60 courses offered from a variety of schools and departments, such as the School of Public Health, Learning Health Sciences, Human Genetics, Industrial and Operations Engineering, School of Information, and Bioinformatics. And what's listed here are some of the titles of those courses. And as I was saying previously, 2 of the precision health competencies must be met, and these courses are also listed in the discovery, treatment, or health domain. So when you look at the approved list of courses on our website, each has a D, T, or H, or a combination of them listed, so you know which course meets those particular domain areas. And again, we encourage students to take as many as they can in their coursework. So some of the requirements of the program include a network opportunity. So you will be paired with a faculty member from the Precision Health Education Work Group in order to meet and learn about each other's interests in precision health. And we encourage you to meet at least once, but it's up to the student and faculty member to determine the number of times to meet. So it's a 12 credit program, and 10 of those are graduate credit hours of coursework, 2 credits of precision health related seminars and journal clubs, which I'll talk about later, a precision health annual symposium, more on that later as well, and no more than 1/6 of the credits required for a master's degree may be double counted, and double counted rules are not are irrelevant to PhD students who do not seek a master's degree. So precision health journal clubs and seminars are required. And in addition, we offer Learning Health Sciences collaboratory sessions, or students can attend other precision related sessions in their home school or other departments across campus. And these sessions aren't regularly scheduled, so there isn't a set date for them like Tuesdays at noon. Rather, I notify students of the seminars, which occur at various times throughout the year. And if a student wants to attend a seminar outside of the program, it must be pre-approved. So as you can see, there are a variety of options available which allow for flexibility in student schedules. So students can complete these seminar requirements over a course of 2 years or however long a student is in the program. Usually students take the seminar for 0.5 credit each term, but they have the option to complete the certificate in 1 year by taking the seminar for 1 credit each term. So if you take it for 0.5 credits, then you're required to attend 2 seminars and submit 2 written reflections. If you take it for 1 credit, that will require attendance at 4 seminars and submission of 4 reflections. And a 1-page reflection is required after each session, which is read by your faculty mentor. And this allows them to understand the similarities drawn between the seminar that the student attended and the student's current degree program. And it also allows them to see how students are really connecting the pieces together for precision health. So by the end of the program, students will have attended 8 seminars total to fulfill the 2 credit requirement. So the Precision Health and Annual Research Symposium is another requirement. And this is a large symposium where there are a lot of talks and poster presentations, student presentations that focus on precision health, and it's a really nice event. And this year's symposium is not scheduled yet, but it'll be in the fall. And you're required to write a 1-page reflection on the seminar. It will be recorded, so if you're unable to attend, then you can review that recording. So there are other activities and opportunities that are encouraged but not required, such as meeting other students at seminars, speaking to the presenters after a seminar talk if they are available, networking with the external advisory board members. And these are opportunities that I will inform students about as they arise. So we have a wide variety of students interested in this program. For example, those who registered for this information session who may be on this call right now are master's and PhD students from School of Public Health and Nutritional Sciences or Health Behavior Health Education, School of Information, Biomedical Engineering, Industrial and Operations Engineering, Pharmacy and Psychology, Cancer Bio, Health Informatics, Learning Health Systems. And the schools listed here on the page are some of our current students, and you can read about them on our website if you haven't already. So as I mentioned at the beginning of the presentation, the goal of the certificate is to provide training around improving patient and population health. The certificate allows students without a background in precision health to get an introductory knowledge set around precision health. And then students continue on in their careers, taking this knowledge from their coursework with them. And there is a deadline to apply, which is August 1st. There are fees associated with the application. If you're a Rackham student, it's $10. Non-Rackham students, it's $75. And international students, it's $90. So that's the end of this very quick presentation. And I do want to thank you everyone for attending. And at this time, I can open it up with any questions. Oh, and this is our contact information. My information is there. And then Dr. Gretchen Pyatt, she is the program director for the certificate program. And I will open it up for questions.
Hi, I joined a little late.
Uh-huh.
Did you say if we're gonna have these slides available?
Yes. Yep. It should be recorded. I'm hoping it is. And then I can send the slides.
Okay, thank you.
Yep. You're welcome. Any other questions? That was an easy one.
Looks like there's one in chat right now.
You know what? Thank you. My chat's up there. Okay, for students interested in continuing precision health in a master's. So for students interested in continuing precision health studies in a master's, what programs are available or recommended? I don't think I'm understanding what programs you're asking about, what you mean by what programs are available or recommended.
Sorry about that. So really, let's say if I finish the certificate and I just wanted to continue my studies, does U of M offer any programs to help me do that?
If
Like
you
just
finish- Okay, go ahead.
right. So let's say I completed a certificate, I wanted to continue my studies in, let's say, a master's or PhD program. Are there any programs available or planned that could help me do that?
Are you a current graduate student now?
Yes, I am. But I'm in the PharmD program, so not a PhD program.
Okay. That one I don't really have an answer for that, but I can ask Dr. Pyatt what her thoughts are on that.
Sure. Thank you. I appreciate that.
I will do that.
I had a question. If we had taken some of the courses that meet or are required for the certificate already, do those count or
Yeah.
they do? Okay.
Yeah, you can go back and count those courses.
Okay, great. Thank you.
Yeah, it's pretty easy to meet the requirements. It seems to be. And seminars, when they created this program 2 years ago, they had a seminar series in Precision Health. That Precision Health is it's a campus-wide initiative, and I always say it's the folks on North Campus because they are the leaders of Precision Health, and we're just a tiny piece of their initiative. And they anticipated having sessions on Tuesdays. And, we started in the fall of 2019, and it started out that way. And then COVID happened. And then it was just kind of, as things came up, everything was remote. So then we started doing everything remote. And at this point, they're not planning to do those like Tuesday seminars. Instead, it's more kind of ad hoc as they come up. And so it just leaves it open. There's a lot of different options all across campus. And the faculty members in our work group, they send us stuff from their different departments. So we have people in pharmacy and School of Public Health and genetics, and they have seminar series in all of those departments. So they send those to us, and then I send them out to students. And if there is a journal club or something in your department, or something you see on the happenings calendar, or something you wanted to attend, you can send that to me, and then I'll get that to Dr. Pyatt for approval. So there's just lots of options to fulfill those seminar requirements.
So with the 1/6 rule, right? For double counting. So that's towards my degree program based on how many credits my program is. So if I have 48 credits, then that's 8. So then that means that I can take 8 overlapping credits, and then 2 are going to be the seminar, meaning I would just take another course that isn't in my program, or there's at least 2 credits in order to be eligible.
Yeah, exactly. Yep. And there's, like I showed you, there's over 60 courses that you can choose from on the website or that are available. And also, if there's a course that you feel that would meet those requirements, then we will review those too. We've had students come to us and ask if a certain course in their department or something would fit the requirements that we're looking for too. And then we will include them in that list of courses.
Oh, that's great.
Yeah. And I was right, there's 9 in attendance, so my guess was pretty close. Anything else?
I have a question.
Sure.
I'm a master student of School of Information, and based on your slides, I saw that some of the courses is related to the School of Information course, or for example, machine learning and data mining. And if I have already taken some of the courses before, and if I want to get this certificate, does those courses can count to this certificate credits?
Yes, they can. Yep. If you've already taken a course that's on that list, you can go ahead and count that in your
Okay.
total credits.
Okay. So I have another issue is I plan to get my master's degree at the end of this year. So it means that I want to finish all my courses in just one term. Now, if I want to apply for this certificate program, can I just finish all the credit in one term? Is it possible? Is it possible?
Unfortunately, the max amount that you can register for the seminars is 1 credit per semester. You can't register for 2 credits, and you have to have 2 credit of the Precision Health seminars.
It means that if I want to get this certificate, I need at least 2 terms to finish that.
Yes, correct.
Okay. So, for example, if my master's degree, I finish my master's degree at the end of this year, and it means that I cannot get the certificate because I have to make sure my current program will at least 2 terms from here, and then I can get this. I can enroll in this program, right?
Correct. Yes. Yep. If you could extend it to the, I guess that would be the winter of 2022, then you could do the program.
Okay. And I have one more question.
Sure.
So once the students get this certificate, what kind of jobs we can apply for? So
it's more giving you just exposure to precision health. There aren't necessarily like precision health related positions, but if you were to go into something, whatever field you're in, and there is like a precision health, you bring that knowledge from your coursework that you took and you bring that in, to your whatever career that you're going into, if that makes sense.
Yeah. So, is there any specific industry we can go? And so, I mean, based on before I get this certificate, maybe I only my background maybe is data science. After I get this certificate, there may be some benefit for me to look for kind of different jobs. For example, maybe do you think maybe pharmaceutical industry is a good choice if we want to look for a job, or some other kind of industry is we can select after we get this certificate? I mean,
well, we have students, definitely have students from all different areas. Like I was mentioning, like we do have pharmacy students and bioinformation and health informatics and School of Information students. So, I mean, it's really such a wide area of different fields that it covers. There's 19 schools and colleges that are part of the Precision Health program. So there's so many areas that you could go into. Yeah, I don't know if that helps you, but.
Oh yeah, sure. Thank you.
Yep, you're welcome.
Yeah, I could say that I'm in information as well, Sarah. I'd love to connect, and that I think it'll definitely make you more attractive if you want to go into like pharmaceutical or something like that. I'm actually interning at a sort of biotech place now, and all this information is like right in line with some of the stuff I'm learning at the internship.
Okay, thank you.
Yeah, thanks, Andre. All right, so if any more questions, if not, again, my information is here and Dr. Pyatt's, and I'll reach out to, I'm going to write that down, Natalia, and get that question answered for you. And the application deadline again is August 1st. It's all through Rackham. And just if there is a course that you want pre-approved that's not on the list that you want approved, you can put that in the application, and then we'll review that at that time. And after the August 1st deadline, we can expect to notify students about within 2 weeks. we'll get our committee together to review and then notify students. All right, well, with that, I will thank you again for coming, and we hope to look forward to seeing some applications soon. Bye, everyone.
Thank you.